Hey everyone, Dr. Mike here. Thanks for joining me today as we tackle a topic that's both important and often overlooked. Today we're talking about Irritable Bowel Syndrome, or IBS, a condition that affects millions of people around the world, yet is still surrounded by confusion and myths. You might be surprised to learn just how many people quietly deal with IBS every single day. IBS is a common disorder of the large intestine, or colon, but unlike diseases like Crohn's or ulcerative colitis, it doesn't cause visible physical damage or inflammation that you can see on a scan or during a procedure. Instead, it's what we call a functional disorder, meaning your gut looks perfectly normal on the outside, but it just doesn't work the way it's supposed to. This can be incredibly frustrating for patients, because the symptoms are real, but the tests often come back normal. The main issue? The communication between your brain and your gut gets scrambled, almost like a bad phone connection where the messages aren't getting through clearly. Imagine your digestive system as a busy highway. IBS messes up the traffic signals, sometimes speeding things up, which leads to diarrhea, sometimes causing a standstill, which leads to constipation, and often creating confusion that results in pain, gas, and bloating. It's like your gut is stuck in a never-ending traffic jam and you never know when the next slowdown or pileup will happen. This gut-brain connection is crucial. When it's off, you get those uncomfortable symptoms that can disrupt daily life, making it hard to focus at work, enjoy meals, or even relax with friends and family. IBS isn't just a tummy ache, it's a chronic condition that can be tough to manage and can linger for years. The symptoms can come and go, sometimes flaring up without warning. It's incredibly common, affecting up to 15% of people worldwide, from all walks of life, all ages, and all backgrounds. Chances are, you know someone who has IBS, even if they haven't talked about it. Many suffer in silence because the symptoms can be embarrassing or hard to explain. It's not easy to talk about digestive issues, especially in public or at work. My goal today is to break that silence and demystify IBS, what it is, what it feels like, and most importantly, what you can do about it to take back control of your life. IBS isn't life-threatening and doesn't increase your risk of colon cancer, but it can seriously impact your quality of life. It can make you miss out on social events, work, or even just enjoying a simple meal. The uncertainty of symptoms can lead to anxiety and stress, which in turn can make IBS worse. It's a vicious cycle that can be hard to break without the right support and information. This isn't all in your head. The pain and discomfort are real, and they deserve to be taken seriously by both patients and healthcare providers. Let's dive deeper into the challenges of living with IBS, explore what triggers symptoms, and discuss practical ways to manage them. Knowledge is power, so let's get started and empower ourselves to better understand and manage IBS together. IBS symptoms can vary widely from person to person, but the most common and often the most distressing is abdominal pain. This pain can be recurring, sometimes sharp and intense, other times a dull, lingering ache that just won't go away. It can strike suddenly, or build up gradually, making it hard to predict or ignore. This pain is usually linked to bowel movements. Sometimes it improves after going to the bathroom, but for others, it can actually get worse. The connection between pain and bowel habits is a hallmark of IBS, and it can make even simple routines feel unpredictable. IBS comes in different types: IBS-D, where diarrhea is the main issue, IBS-C, which is dominated by constipation, and IBS-M, where symptoms alternate between diarrhea and constipation. Some people may even experience both extremes in a single week, adding to the confusion and discomfort. This unpredictability makes planning life difficult and adds stress, as you never quite know when symptoms will flare up or subside. Bloating is another major symptom. Your abdomen can feel full, tight, and swollen, sometimes making clothes uncomfortable or even painful to wear. This sensation can come and go, but when it's present, it can be hard to focus on anything else. Excessive gas is common too, and can lead to embarrassment in social situations or discomfort throughout the day. Together, these symptoms, pain, unpredictable bowel habits, bloating, and gas, define the classic IBS experience, but each person's journey is unique. The roller coaster of symptoms can make daily activities challenging, from work and school to social events and travel. Many people feel frustrated by the lack of control, and it's common to feel isolated or misunderstood by others who don't experience these symptoms. It's not just about the bathroom, it's about how these symptoms affect your whole life. from relationships to your sense of well-being. IBS is a complex condition with a wide range of experiences, affecting people of all ages, backgrounds, and lifestyles. Recognizing your own pattern of symptoms is the first step to managing it, and keeping track can help you and your doctor find the best approach. Let's look at who's most likely to develop IBS and how understanding your symptoms can lead to better control. Understanding the symptoms is the first step toward taking control and improving your quality of life with IBS. IBS can affect anyone, but it most often starts before age 50, sometimes as early as the late teens or 20s. Women are up to twice as likely as men to be diagnosed, possibly due to hormonal differences. Many women notice symptoms worsen during certain times of their menstrual cycle. IBS tends to run in families, suggesting a genetic predisposition. Stress and past trauma also play a role. People with high stress or a history of trauma are more likely to develop IBS. The gut-brain axis is key. Stress can change how your brain and gut communicate, making you more sensitive to digestive issues. It's not just one factor. Genes, hormones, and environment all contribute. Now let's see what daily life with IBS is really like. The exact cause of IBS isn't clear, but several factors are involved. The leading theory is a problem with the gut-brain axis. Communication between your brain and gut becomes hypersensitive. This visceral hypersensitivity means normal gut sensations feel painful. Abnormal gut motility is another factor. Too fast contractions cause diarrhea, too slow cause constipation, and erratic ones lead to mixed symptoms. The gut microbiome also plays a role. People with IBS often have a different balance of gut bacteria. Sometimes, a stomach infection can trigger IBS, leading to ongoing symptoms even after the infection clears. It's likely a combination of these factors: nerves, motility, and microbes. There's no single cause, which makes IBS tricky to treat. Understanding the root issues helps guide treatment. Next, let's see how doctors diagnose IBS. Diagnosing IBS is about evaluating symptoms and ruling out other conditions. There's no single test for IBS. Doctors use criteria like the Rome-4 recurrent abdominal pain at least 1 day a week for 3 months, plus changes in bowel habits. A detailed medical history and physical exam are key. It's important to be honest about your symptoms even if they're embarrassing. If you're under 50 and have classic symptoms, a diagnosis can often be made without extensive tests. Red flags, like weight loss, bleeding, or symptoms starting after age 50, mean more tests may be needed. Tests might include blood work, stool samples, or a colonoscopy to rule out other diseases. Once diagnosed, the focus shifts to managing symptoms. Managing IBS is highly individual. What works for one person may not work for another. Stress reduction is crucial. Activities like walking, yoga, or mindfulness can calm the gut-brain axis. Regular gentle exercise helps regulate bowel function and reduce stress. Sleep and enjoyable hobbies also support overall well-being. For some, medications can help: antidiarrheals for IBS-D, fiber or gentle laxatives for IBS-C, and antispasmodics or low-dose antidepressants for pain. The key is a multi-pronged approach: lifestyle, diet, and sometimes medication. Work with your doctor to find what works for you. Small changes can make a big difference. Consistency is more important than perfection. Next, let's talk about diet.